Good afternoon and welcome to the public hearing on Bill 72, Opioid Damages and Healthcare Cost Recovery Act. My name is Caitlin Cleveland. I am the chair of the Standing Committee on Social Development and I am also the MLA for Cam Lake. This meeting is being broadcast on the Legislative Assembly channels. And today we welcome the Minister of Justice, the Honourable R.J. Simpson, before committee to discuss Bill 72. Before we begin, I'd like to encourage the public listening in to provide feedback or comments to committee to inform our review of this legislation. If you would like to provide comments or engage with committee on this bill, please contact our committee staff by email at committees@ntassembly.ca. At this point, I would like to turn the floor over to my colleagues to introduce themselves for the record, and I'll start with the colleague to my left.
Hi, Richard Ajeric, I'm MLA for Trinity.
Thank you so much. I'll turn it over to members online, starting with MLA Bonnet Rouge.
You're muted, Ron.
Oh, sorry. Ron Bonnetus, MLA Techo.
Good afternoon, everyone. Alan Johnson, MLA, the Yellow Heights one.
Lisa Summer, MLA Neighbor Twin Lakes.
Katrina Knockleby, MLA for Great Slave.
Thank you so much, members, and thank you to everybody from the public who has joined us here as well. I would also like to introduce our staff who have joined us here today. We do have our law clerk, Sheila McPherson. We have our committee advisor, Mahalia Gakalaya Newmark. We also have our committee clerk intern, Taylor Maxwell, and our committee clerk, Amy Lizotte. With that, Minister, I would like to turn the floor over to yourself and would ask you to please start by introducing your staff and then proceed with your opening remarks. Thank you.
Thank you, Madam Chair. Can I just confirm with you that there are two Justice staff in the room with you?
They're online, Minister?
Oh, they are? Yeah.
Yeah.
All right, thank you very much. I heard you talk about letting them into the room, so I guess it was the virtual room, so sorry about that. Thank you, Madam Chair. I am pleased to be here to discuss Bill 72, Opioid Damages and Healthcare Cost Recovery Act. Bill 72 will permit the government of the Northwest Territories to file a lawsuit to recover from manufacturers and distributors of opioid drugs for past and future healthcare costs incurred on behalf of Northwest Territories residents for opioid-related illnesses. Today, I am joined by Thomas Walwork, Legal Counsel with the Department of Justice, Laura Jeffrey, Legislative Counsel with the Department of Justice, and my Ministerial Special Advisor, Ronna Sherigan. The opioid crisis has incurred substantial costs to federal, provincial, and territorial governments who have spent increasing amounts on healthcare to address the fallout of opioid overprescription. British Columbia has enacted its own opioid cost recovery legislation and is in active class action litigation before the Supreme Court of British Columbia. This action could include all federal, provincial, and territorial governments as potential class members in this lawsuit and seeks to recover the opioid-related healthcare costs of the potential class members. Currently, the GNWT's ability to independently recover opioid damages is in question, as the applicable limitation period has expired under the Limitation of Actions Act. As our legislation stands, the GNWT may be unable to recover healthcare costs under British Columbia's opioid action. The proposed legislation would not only remove the existing limitation period barrier to such a claim, but also improve the likelihood of the opioid action's success by establishing a common issue across all jurisdictions in Canada with that legislation. This would simplify the advancement of the opioid action. The proposed new act would provide a statutory basis to sue manufacturers and distributors of opioid drugs directly for opioid-related wrongs, provide the ability to sue opioid producers and distributors on an aggregate basis without having to identify particular insured persons who suffered harm, provide simplified formula to determine the individual share of liability for each opioid producer or manufacturer named in a lawsuit, provide the ability to base claims of harm on statistical and sociological data, and extend limitation periods applicable to actions based on opioid-related harm. Approximately 8 other jurisdictions have enacted their own versions of this legislation, and the wording of the proposed new act is virtually identical to the existing legislation in other jurisdictions. Thank you, Madam Chair. This concludes my opening remarks, and we would be pleased to answer any questions members may have regarding Bill 72. Thank you.
Thank you very much, Minister. Members, I would like to open the floor up for questions that any members might have at this time. Would anybody like to start us off? So maybe I'll start with a question then. Minister, I'm wondering if you can clarify under the Opioid Damages and Healthcare Cost Recovery Act, what healthcare costs can be sought to be covered through this piece of legislation, through these class action lawsuits. What will qualify and what would not qualify? Thank you.
Thank you. So, services where the GNWT has paid for and provided healthcare benefits as a result of an opioid-related wrong would be recoverable. So, perhaps for some more detail on this, I can hand it to Mr. Walwork. Thank you.
Thank you very much, Minister. Mr. Walwork.
Yes, thank you. And just confirming everybody can hear me all right. So yes, the scope of what can be recovered is actually set out directly in the legislation itself. So there's a definition of healthcare costs that are recoverable under the Act, and I'm just going to turn briefly to that now. And in terms of the specific definition, I want to read off of it so I'm not leading anybody astray. So the definition of healthcare benefits under the Act includes any insured services, as that term is defined under the Hospital Insurance and Health and Social Services Administration Act, any benefits and insured services that are defined in Section 1 of the Medical Care Act, and other expenditures made directly through one or more agents or other intermediaries by the government of the Northwest Territories for any programs, services, or benefits associated with opioid-related disease, injury, or illness. So it's quite a broad spectrum, but the idea behind the legislation overall and the idea of getting these damages to begin with is to shift the responsibility for the additional healthcare costs caused by the opioid crisis to the manufacturers instead of the government. So whatever out-of-pocket healthcare costs would have been incurred would be recoverable, and there's also a portion of the damages that would cover future expenses associated with existing cases as well. So I hope that's enough specificity for you, but I'm happy to answer further questions.
Thank you very much. And as a follow-up to that question, I'm wondering if it's possible to give us an annual kind of estimated cost of what those things are costing the government of the Northwest Territories today. Thank you.
I don't have that information on hand. I'm not sure if Mr. Walwork might have some more detail.
Thank you, Minister. Thank you, Minister. Mr. Walwork.
Yeah, it's difficult to pinpoint the exact cost right now. What I can tell you is that at the time that the BC class action was filed, the Northwest Territories had the fourth highest rate of opioid hospitalizations and deaths in Canada. The rate at that time was listed at 4 individuals per 100,000 per year. And it's difficult to put an exact number on what that's costing us, in part, and that's in part why we need the legislation in the first place, is because ordinarily, were we to recover these kinds of costs, we would have to track down each individual affected claimant, as well as, and prove that entire chain of causation. Whereas what this bill is going to do is introduce the ability to simplify that process and to just use budgetary data, population data as an evidentiary shortcut. So there are settlements that are underway now. There's one that was recently publicized from Purdue, Canada, out of British Columbia, and that was the largest settlement, the largest governmental healthcare cost settlement in Canada to date. That was for $150 million for the entire country. Now, in terms of what we're going to get out of those settlements, that's still a little on the unclear side, and it would depend entirely on passing this legislation. But the answer is unfortunately kind of unclear at present.
Thank you very much. I'm going to turn the floor over now to MLA Semler.
Thank you. Just to keep adding on to that kind of theme that with the costs, and I would like to know if this bill will also take into consideration other costs that stem from, like when we think of the things like inpatient opioid overdoses, addictions, this type of stuff, but it's also impacting our child and family services area. We're probably spending a lot more money in that area with children, maybe mental health, because parents are suffering from the addictions of opioids. We've got our homelessness area. And there's all these different areas. We had a public presentation yesterday kind of drawing out a lot of these things that are related to this. And I'm just wondering, will we be able to calculate some of those damages, kind of how this ripple effect is actually affecting other areas that we as government supply funding for services?
Thank you, MLA Semler. Minister?
Thank you. And we won't be able to recover the full cost. As the member mentioned, someone might have addictions issues related to opioids, and then they have the GNWT incurs additional costs beyond that might not be specifically related to the health benefits, the healthcare benefits. Because as the member said, there's a ripple effect, and this goes on and on and on and on. But maybe Mr. Walwork might have some more detail about exactly, where that limit might be. Thank you.
Thank you, Minister. Mr. Walwork?
Yes, I'm afraid I don't have a huge amount of addition to what the minister is saying. The idea is, it wouldn't be a complete recoup of all of the costs, and that largely comes from how we'd be calculating damages in the first place. So we'd be using statistical and economic data. It wouldn't be a literal accounting. It would be just that there's a increased opioid expenditures over a particular baseline. But it's very difficult to exactly pin down what specific things are going to be paid for and what aren't. It's more of a broad approach to getting damages.
Thank you, Mr. Walwork. MLA Semler, do you have a follow-up question?
Yeah, and with that, thank you for that information. I'm sure there's a lot more questions than there is answers right now. If we are to get money, I know, and this came also to committee, is, with Indigenous governments, I think, although they're not providing the insured services benefit, they are providing services as well to their beneficiaries, their participants, their members, and in certain areas, they're providing them with access to treatment, because sometimes, and we've heard this over and over again, that going through the insured service process is very difficult. And so sometimes if they have somebody in a crisis, they may cover the cost for them to get out for treatment and things like that, and kind of start, but maybe health takes over at the end. I'm just wondering, is there going to be room to be able to discuss this at the Indigenous government tables if we do receive money, to be able to have a way for supporting Indigenous governments to do to recoup some costs that they may endure with supporting their members with this opioid crisis? Thank you.
Thank you, MLA Semler. Minister?
Thank you. So the funds that we would receive would go into general revenues, and then it would be up to the government to determine how to use those funds. And what the member is speaking about is definitely conversations that I know this government is always open to talking to Indigenous governments. I don't expect that we'll be seeing any money in the life of this government. I'm not sure if it'll be in the life of the next government or the one after that. These things take quite a while. It does not specify that in the Act. That would be more of a decision of the government of the day. Thank you.
Thank you, Minister. I'll now turn the floor over to MLA Knockleby.
Thank you, Madam Chair. My question is, and I kind of already know the answer, but I'll let the minister say it and then we can talk about it afterwards. Has any of this money, when we do receive it, will it be earmarked and definitely specifically set aside for use in addictions and treatment to fund our programs so that we can get out of this vicious cycle? Thank you.
Thank you, Emily Knockleby. Minister?
Thank you. And again, that will be a decision for a future government. Right now, the money would go into general revenues. We generally don't tie money received to specific programming unless that money is received through a program or through an agreement with, say, the federal government, and the money's earmarked for that. But the answer is no. This would be going to general revenues, and then the government of the day would determine how to spend it based on the needs that and the issues they're facing. Thank you.
Thank you, Minister. Emily Knockleby, do you have a follow-up?
Thank you. And yes, that was the answer that I was anticipating. However, this government is able to make recommendations to future governments, and I kind of find the sort of the answer of money going into the general sort of coffers kind of a bit of just an accounting excuse, because we can always commit funding for certain areas, whether that funding coming out of the general coffers. So, even though we don't earmark funds from a specific tax, like, for example, cannabis and liquor to go back towards addictions, it doesn't mean to say that we couldn't turn around and say, well, we anticipate $5 million here. We want to put $5 million into our treatments and addictions. And I guess I just have more of a comment that I would hope that the minister would actually make this as a recommendation to the next assembly, that any monies from this be immediately turned around and put into treatment options for our people. I'm currently dealing with people trying to get into treatment. We're at a 4-month wait. So I would find this to be quite a bad PR issue for the government if they're to go out and collect damages on the backs of people that have had opioid addictions and then turn around and use that money for other things. So I think it would be worthwhile to actually state and stipulate at this point that any money that comes in from this lawsuit will go back to treatments and addictions. Thank you.
Thank you, Emily Knockleby. Minister?
Thank you, and I can bring that discussion to cabinet. I don't have the unilateral authority to say something, to make that commitment, but I can have the discussion with cabinet. Thank you.
Thank you very much, Minister. Members, does anybody else have any questions for the minister in regards to Bill 72? I might ask a couple more questions, and if anybody has any questions, please let me know at any time to any of the members who might want to ask a question. One of the questions here, or the comments and questions from my colleagues, has been around essentially revenue sharing from these class action lawsuits with other organizations that might be also fielding the costs of the opioid crisis. And specifically, the conversations have been around NGOs and Indigenous governments as well. Is there an intent to also ask Indigenous governments and NGOs to report to the GNWT about the expenses that they are incurring in relation directly to the opioid crisis? For example, if Indigenous governments are spending dollars of their own to send people through to treatment, so that the GNWT really does have kind of an NWT-wide idea of the full cost of the opioid crisis in the territory. Thank you.
Thank you. And I know Mr. Walworth commented earlier about how the damages might be calculated. Perhaps I can get him to expand on that and talk about, what that calculation might look like here in the territory relative to other jurisdictions, whether or not it's similar or different, or how that might be handled. Because, like as I stated, this is legislation that is nearly identical to most of the other jurisdictions in Canada. But through you, Madam Chair, I can hand it to Mr. Walworth. Thank you.
Thank you so much, Minister. Mr. Walworth?
I'm not sure. I mean, obviously, consultation is always a good thing, but I'm not sure that the data is necessarily required. When it comes to the definition of what costs are going to be recovered under this legislation, it would all be additional costs that they're insured services, and those are already predefined insured services that are going to be recovered. So I mean, it would be services that that physicians would be billing up to the central insurer anyway to get reimbursed. So I mean, the records are already there, and if there was something that a physician working with, say, the Calicho or another indigenous government had provided, they would have presumably billed that as well. And so the information would already exist in kind of the central the billing arrangements that we already have with physicians and healthcare practitioners. In terms of exactly what would qualify in terms of reimbursement and how you'd share cost afterward, that's a little out of my bailiwick. But yeah, the intent is that we'd be simplifying the calculation of damages and removing the need to do that much data collection. And so that if there was an independent lawsuit, that we would just scrape the information from whatever physicians had already billed for, and whatever healthcare services are already on the books.
Thank you very much, Mr. Warwick. In relation to that then, and I mean, I guess one of the reasons I'm asking about that reporting mechanism from NGOs and Indigenous governments is should, the commitment made to Emily Knockleby to kind of take that back to cabinet, should that progress farther without knowing what other organizations are spending, then it's hard to address kind of cost sharing down the road, and without having that mechanism. And so I'm also wondering, just in regards to kind of transparency of what's going on. There's no piece in here about reporting whether or not the GNWT is involved or reporting what costs are recouped. And so I'm wondering why that was left out, and also what the plan is from the GNWT's perspective on sharing the revenue received through this act with the public. Thank you.
Thank you. So that would all be public information for the details on how a class action would be settled and how cases are publicized and posted. Perhaps I can go back to Mr. Walberg. Thank you.
Thank you very much, Minister. Mr. Warwick?
Yes. Right now, I mean, I'd mentioned earlier that the first settlement under the opioid litigation or the class action litigation has already been publicized. It's with Purdue Pharmacy Canada. Now, the proceeds of that settlement, I mean, obviously we wouldn't be entitled to a share of that without enacting this legislation, but exactly how much of a share we'd get is still in question. There's active negotiations going on between all interested parties. It's boiled down to exactly how the proportionate share would end up being calculated. It's either going to be based on the total population of a particular jurisdiction or the specific number of cases arising out of that jurisdiction. And we haven't agreed on which of those models we're going to pursue. But the difference from our perspective is negligible. Because the answer to each of those questions from the point of view of the Northwest Territories works out to be very, very similar, and not worth too much notice. I can look up the exact numbers, but it's like a 0.02% difference, I think, of between the two. So it's a very small difference.
Thank you so much, Mr. Walwork. My last question is in regards to, so this is a piece of mirror legislation that is also being used in other jurisdictions across Canada. So, and my understanding is one of the strengths of class action lawsuits are the commonalities between the parties coming together and launching that class action lawsuit. So if we in the Northwest Territories amend our legislation and it is different and is no longer a mirror piece with other jurisdictions, what is the impact of that and the NWT's ability to participate in a class action lawsuit? I just want to better kind of understand that. Thank you.
Thanks. There's a few key components that are required in the legislation. The creation of the tort of opioid-related wrongs. And you know what? I don't have it in front of me, so I'm going to hand it to Mr. Walwork so I don't get the technical terms incorrect. Thank you.
Thank you, Minister. Mr. Walwork.
So yes, I mean, broadly speaking, it's a good idea to remain as close as possible to the British Columbia legislation. First, because the British Columbia legislation was modeled on tobacco legislation. So back in the late 90s, as we all know, there were class action litigation against major tobacco companies, and British Columbia actually is following the same broad playbook. And the reason why they modeled the opioid legislation after the tobacco legislation is because the tobacco legislation had passed a constitutional muster at the highest level. So it went all the way up to the Supreme Court of Canada, and it was approved there. So we know that this model is constitutionally sound, and that's one reason to keep it similar to what the British Columbia legislation is. As Minister Simpson was alluding to, there's also the creation of this new tort. Now this is the one of the key pieces of the legislation that cannot be changed for any reason, because that's the foundation of the damages. Is without this new statutory tort, there's no legal basis to get any damages at all, really. So that element has to stay there. Now, the third reason, the third element that's quite important is the limitation period. So, I mean, this is one of the elements which is one of the elements that actually differs from jurisdiction to jurisdiction, because everybody's got a different statute of limitations. But in all likelihood, we'd be precluded from litigating this at all for limitation purposes. So our limitation date would have elapsed quite some time ago, and this legislation would also remove that barrier. So we've got a number of different reasons to keep things similar, and the constitutional validity is a big one, but the biggest by far is the creation of this new tort. And without that tort on the books, there really isn't a legal basis for damages at all.
Thank you very much, Mr. Walwork. I really appreciate that clarification. Members, are there any additional questions for the minister? Excellent. Thank you so much, Minister Simpson, and to your staff as well. Thank you, Mr. Walwork, for joining us here today. That is very much appreciated, and being able to answer these questions. Before we close this broadcast, I would like to again encourage members of the public to provide feedback to committee, and that can be done through email or by contacting your MLA who serves on, or an MLA who serves on this committee. But the email address for the committees is committees@ntassembly.ca. And I'd like to thank all the members of the public who have joined us here today as well. Thank you.